If you're a female and live to be a certain age, it will happen. You'll receive a visit from the hormone fairy. Up next, I'll show you my hormone replacement regimen and demonstrate how pellets are inserted into the body. Hi everyone, I'm Judy and welcome to Sexy in Your 60s, Beauty from the Inside Out. A big thanks to those who've subscribed to my channel. If you haven't yet, please hit the red button below the screen to subscribe and then click the bell next to it for future video alerts. Has your doctor prescribed you a one-size-fits-all estrogen pill for those hot flashes? Oh, maybe an antidepressant for mood swings, or a sleeping pill to help you sleep. If you watch my previous videos, you should understand why it's critical to replace not just one, but all three of our main sex hormones after menopause. Today, you're going to learn the protocol on getting started with bioidentical hormone replacement. I'll show you how I apply my hormones, and these hormones were prescribed under the medical guidance of a physician who's highly trained in integrative medicine and, most importantly, knows how to dose them. Now, I started in my early 40s with a blood test to see what my hormone levels were. My estrogen, progesterone, and testosterone barely registered. I also had a pap, pelvic, and mammogram. So after the doctor reviewed my labs and then ruled out other causes of my symptoms, he made a plan, and I've been on that plan for about 10 years with a little tweaking here and there. So every morning, I use an estrogen cream. All right, this is the little green one. It's called Biased. It has two of our good estrogens in it, estradiol and estriol, and you need both. But you won't get both in the estradiol pill that you get from the pharmacy. So I rub the cream on areas of the body that don't see a lot of sun, such as the inner arm or the inner thigh, and I rotate these areas each day. Now, this cream is transdermal. And what that means is it's absorbed through the skin into the bloodstream and it goes directly to the needed cells. I also use a progesterone cream, and this is very important if you still have a uterus and breast, because progesterone has been shown to lessen the risk of some of the cancer-causing effects of estrogen. So let me show you how easy it is to do all of this. And my prescription calls for 4 clicks of each of these. Okay, so I'm not going to use these because I've already put them on for the day, but I'm going to use just a little sample. This is not really the cream, but this is similar to how it looks. So you'll go 1, 2, 3, 4, or however many clicks that your doctor prescribes. You'll take that cream, and as I said, you'll rub that on either the inner arm or the inner thigh, maybe the neck, maybe in here in the stomach area, somewhere where the sun doesn't shine. That's pretty much the protocol on that. Now, I also take a compounded pill. It's a progesterone pill, and it kind of looks like this. And I usually take a couple at night, and this gives me added protection from the effects of estrogen. But when taken by mouth, it's metabolized in the liver. Now, we actually want this effect because the liver breakdown produces GABA in the brain, and that helps us sleep. It also produces serotonin, which calms our moods. So if you aren't sleeping well, and you haven't since menopause, you will be amazed at how well this works. So then, we also addressed my low testosterone level. I first tried the creams, okay, but I couldn't get optimum levels with that. So then I decided to try the pellets, which are implanted just under the skin in the upper quadrant of the buttocks. And they're designed to last about 3 months in women, 4 to 5 months in men, and they give a constant therapeutic level, just like my body did in its prime. And I truly believe that this is the best way to supplement with testosterone, because, I mean, it is a life changer. You really do feel it. So when my medical director took the course on how to implant these pellets, I attended the course as well, because I needed to know how it was performed so I could discuss it with our clients. So now I'm going to show you how most doctors learn this procedure, and I think you'll be amazed because I certainly was. We're not going to work on a real patient today, and this is how the doctors did it. They worked on something called an eggplant. I'm sure you've seen this in your store, your grocery store, and our eggplant today is a 2-year-old eggplant, and this is exactly how the doctors learned in the class to inject the pellets. So I'm a little nervous about this because I want to hurt this little eggplant. So now I'm going to show you exactly how it's done. I think it's kind of interesting. I think you'll like it. So what the doctor typically will do is he'll come in, and he's, of course, is going to put on his gloves and make sure everything's sterile. And then he's going to take some lidocaine, and he's going to inject you with that. First of all, he's going to clean the area off. I'm not going to do it exactly like they do it, but this is just an example of what it's going to feel like. So he's going to clean the area, inject it with lidocaine, get you pretty numb so you don't feel really anything. And he'll wait, and he'll wait about 10 minutes until that lidocaine takes effect. And then he's ready to inject the pellets. So he will get extra sterile at that point using some iodine swab sticks, and he'll really, really clean that area off. Okay, and at that point he's going to make a cut, and it's just a little scalpel. Here's what it is, and it shouldn't hurt because you're already numb. And he'll make a tiny little incision, very, very tiny, about 1/2 of an inch, and that allows him to be able to insert something called a trocar. This is the trocar right here, and this is it has little grooves in it where the pellets go, and this will allow the doctor to insert the pellets deep up, not deeply, but up into the area where it belongs, just right under the skin. So what we're going to do is we're going to take it right now, and we're going to stick the trocar into the area that he did cut, and then we're going to go up with it, pull this out. Now we're going to take our pellets. They're very, very small, and women don't get but about 1 or 2. Men get a lot. That's why their pellets last longer. And then at that point, once the pellets are loaded, we'll take this little stick and we'll push them into the skin, and that pushes them about 2 inches from the trocar, and then pull the trocar out. The incision is closed not with stitches, but rather with steri strips. So he puts about 4 or 5 steri strips on there. You can't bathe that night and get it wet, but you can the next day. And you're not supposed to exercise for a couple of days either, any strenuous, because you don't want the pellets popping out. And that is pretty much how it's done. And this was a very enlightening class for me. So I hope it was for you as well. Now you know my secret to feeling young and sexy on the inside. I love it so much that I will supplement with bioidentical hormones for the rest of my life. And by the way, my 87-year-old mother and father also use bioidentical hormones, and they feel and look great, and their minds are sharp as a tack. You're never too old to start. As a side note, you can't stop these at any time. You will just revert to your original baseline and feel miserable the rest of your days. So now you have a good idea of how to approach bioidentical hormone replacement. I ask you to please do your research. It can be difficult for some people to understand the hormone pathway, so just remember this. Replace what you made in your youth, and your mind and your body will respond as it did in your youth. So next week, I'm going to switch gears. We're going to get off of hormones, and we're going to talk about vaginal rejuvenation. I'll show you an FDA-cleared, non-invasive device that I sell in my medical spa that rejuvenates the vaginal walls. It makes intercourse more pleasurable, and it also helps with incontinence. And most importantly, it can be used in the privacy of your own home. So thank you so much for watching today. If you like my videos, please hit the red button at the bottom of the screen to subscribe and ring the bell for alerts for future videos. I welcome your questions and your comments, and I look forward to hearing from you. Have a lovely week.